So when do I go to the hospital for a possible kidney stone? Let's talk about that.
So this is a serious one, and this always,
Mhm.
when Jeff and I decided to do this one, I was like, oh, I always my stomach churns, and I'm a nurse for Pete's sake. But the stories I've heard over the years, I had a couple stories this week that were really horrifying. I have to tell you, um, bad. And when you're shocking me after almost 30 years, they were really bad stories like sepsis, and I get a lot of that, but really bad. So I just want the medical community to really take these damn stones seriously, because the pain and havoc that they bring to people, and then the fear, the post-traumatic stress syndrome that people have from kidney stones, again, it's a real thing, because kidney stones are such sudden onset, and the pain for many people are excruciating. With that, I'll also tell you, there's many, there's many people that don't have any pain when they pass a kidney stone. But you have to understand, you don't hear from them, because those patients feel so bad that they haven't had pain, because all you hear is about people complaining about the worst pain ever. And they'll tell me on the phone, Jill, so I didn't have any pain. And I'm like, don't worry. They have like survivor's guilt. I'm like, don't worry. Many people don't have pain. They just, you don't hear about them. They're not complaining. They're not saying that. You're going to be the one that says, oh, sorry, you almost passed out and you were septic, Fran. I had nothing. You know what I mean?
Mhm.
So there's a lot of people that don't have pain. But the question is, how do you know when you should go to the ER? I'm going to preface this episode too by noting that these days our healthcare system is tough, to say the least. So nobody wants to have to go to urgent care or the ER if they don't have to. So believe me when I tell you these are signs and symptoms when you should go. They are. I would never just send you to the ER. Well, go over, see what they're going to say, because you're going to be there at least 8 hours in most cases. Okay. So this is when you should go. The end. Okay. So this is on my blog, and it's called When to Go to the ER for Kidney Stones. So it's right there, a kidney stone diet. So these are common signs you should go to the ER. When you have a fever, that typically is sign of infection. Get your bum over to the ER. Don't mess around with that, folks. Don't be taking a Tylenol to bring it down. If you're having kidney stone symptoms and a fever, right to the ER you go. Get your wife, get your husband, get your partner, off you go. When you simply can't find pain relief. If you're having intense pain, what's intense pain? Everybody's different. Women will tell me, Jill, I've never seen my husband cry. And there he was on the floor. Or men will say, I've never seen my wife this sick. She was throwing up, diarrhea, all of it, couldn't get comfortable. You got to go to the ER. You're passing a stone, most likely, and you need relief. It's not going to get better. Now, sometimes people will say, it got really bad, but then all of a sudden the pain was go. And plop, plop, there it was in the toilet. But if this is pain that you cannot get relief from, and it's lasting, okay? And you'll know. People know. They're like, oh my God, Jill, I knew. I ran to the ER, or I got somebody to get me to the ER. You know, because it will be the worst pain of your entire life. There's no compromising. A lot of people, especially people who live on their own, 911. That's how bad it is. Okay.
And
When you have, go ahead.
where about would the pain be in
Well, thank
general?
you, Jeff. The pain can radiate. The pain can be in your groin. The pain can be in your back. It can be in your upper back, lower back. It can radiate from your back to the groin, left, right. It can move around. Men will say, I feel it in my coming right by my penis. I feel, that I've had men take a pen cap to their penis to try to get the stone out. I mean, that's how much pain. I want to make sure, I know that's very graphic, but at pencil tips, just so you know, this is the kind of pain people are trying to get rid of. And that's where they go with it, because they're just looking for relief. Okay? That's the kind of pain. Can't make this pain up kind of pain. Men are doing that. So it can move around, and people will say, I was gardening, Jill, and I felt some pain in my back, and I felt that way for several days, but I just thought, I was gardening. Until then, I woke up at 3 a.m., always 3 a.m., and I was not from gardening anymore, and I had to go to the ER. So people my age, a little older, 60s, late 50s, this is who I'm talking to every day, 70s, they just think, oh, it's my sciatica, it's this or that, until they know that it's not. Okay, so lots of times it can mimic just simple back pain, and then it can go away. Maybe the pain was moving and it got into a new place in the kidney, or maybe it went right above, maybe it got in the bladder, maybe it was just right by the ureter. Now, if you're on YouTube, you can see me, but if you're on Spotify or Audible or Apple, wherever you're listening, you have your kidneys, your upper back, little upper mid back, and then you have these tubes, one tube from each kidney, and those tubes will take your urine to your bladder. And sometimes these stones, lots of times, these stones get stuck in the ureters, and that's where you're getting all the pain, and it's going to block your urine, and that's when you can get septic. There's so much that goes into this, okay? So, fever, you can't find intense pain relief. You're just have continuous diarrhea, continuous vomiting. I want you to go to the ER for that, because you're going to be severely dehydrated and you're going to be in trouble for that. So I'm talking like you can't get off the commode, whether you're throwing up in it, you're pooping in it, whatever you're doing, it's just nonstop. You got to get to the hospital for that. Cloudy or red urine. Cloudy urine can indicate an infection. Red urine, typically, it is blood. You want to check that out, okay? Now, cloudy or red urine, if you're passing a stone, you're going to have blood in your urine, okay? It doesn't mean you necessarily have to run to the ER, but if it's in combination with cloudy urine, you might want to, at the very least, call your doctor for that. Now, if you have red urine, please pay attention to this. Red urine means blood in the urine. Okay? Blood in the urine. A doctor will take that very seriously. Yes, it can be a kidney stone, but they are going to want to rule out bladder cancer, because that is a sign of bladder cancer. Do not dismiss your urine looking red, ever. You need to rule out cancer. That's a serious thing. I know, I've had bladder cancer, so I know. Okay. The other common sign that you should go to the ER is this is very important as well. You feel like you have to pee, but nothing's coming out. It could be a stone that's blocked your ureter, and it's blocked your urine flow. If pee can't leave, it's going to get backed up. That's a serious thing, and that's when you can get septic. So if it feels like you have to pee, but nothing's coming out, it could be a UTI, yes. But if this is happening along with all these other things that I just talked about, that's when you go to the ER. Okay? Does that make sense? That's an important sign. Now, I'm going to pin this with, sometimes we feel if we have a UTI, you feel like you got to pee, nothing's coming out. So when do you know I should go to the ER, and when is this a UTI? So UTI, normal UTIs versus a kidney infection, perhaps from a stuck stone. UTIs are uncomfortable and go away on their own typically. But if you have frequent UTIs, you go to the doctor, they're like, yeah, Cindy, you got a UTI. Take this antibiotic. You take the antibiotic, you feel better, but it keeps coming back. That could be an infected stone in your kidney. And that's really important too. So let me explain this to you. Some of you, I have had a lot of patients with this. Some of you will come to me and say, Jill, I have UTIs a lot. And I will say, do you have stones currently? Yes, I do. Has the doctor ruled out that those stones are causing the infection? No, not yet. Many times you guys will have stones that have infections inside of them, and they're causing the constant UTIs. You've got to talk to your doctor about that. So lots of times you'll just have a UTI because you didn't wipe yourself properly, sex with a partner, blah, blah, blah. People get UTIs. If it keeps coming back, that could be a signal that a stone that you have inside you could be causing an infection. I would talk to my urologist about that, okay? That's a problem. You don't want to delay treatment on constant UTIs. You want to push back with your doctor if you have a current stone. Now, when do we have signs of a kidney infection? When do we have an infection in our kidney? What are the signs of that? Could be back or side pain continuously, fever, chills, again, nausea, vomiting, pus or blood in your urine, and the inability to urinate. So these are also, they go along with the things that I'm telling you. You should go to the ER for that because it could be an infection. That's when you want to run over there. So there are, and you guys should go to this article, my blog, Kidney Stone Diet, when to go to the ER for kidney stones. If you just Googled when to go to the ER for kidney stones, you can find it. But it's a nice little list of things that you can determine when you should be going, because again, many of you may not have insurance. It's not like I don't understand that. A trip to the ER is not something you just go because you have a sniffle. You're not going to go to here's what I'm trying to say. I need to calm down because this kind of stuff, I get very passionate about this. Many people will put off going to the ER because they don't have money. That's a real friggin' thing in our country. And it's disgusting to me, but that's the way it is. And the other reason is they may have health care, but it sucks. It's not good health care. And so, they're like, I don't want to have to go there if I don't have to. I don't have money for $1,000 visit. But guys, you got to pay attention to those symptoms. So I'm telling you to go to the ER without just, Jeff, help me here. I'm telling people to go to the ER. It's really important, but I would never just say it without thinking this is real money, folks. So.
Oh, yeah. Mm-hmm.
How am I saying that? Help me say that better. I would never be glib about that.
Mm-hmm. Yeah, it doesn't escape you that it's a big choice to make, but sometimes it's very important. And it's like that can be very serious to postpone it too long.
Yes, thank you. Because I have had patients die from sepsis because their spouses called me. They waited too long, Jill. I have a sepsis, which means you have an infection in your body, that you have an infection in your blood caused by a kidney stone problem, and now it's going into your organs, and your organs can fail. This is serious. It's not rare. It's also not common. This is something I hear a story about probably a few times a month. Okay? So I'm bringing it up, guys, not to scare you, but those are warning signs that you should hop on to the ER. Again, I'm going to encourage you to save that article, when to go to the ER for kidney stones. Just put Jill Harris. You'll come up at Kidney Stone Diet and save it and really look at it. There are important things that in this day and age that somebody might put off because of our healthcare system being what it is, but please don't, because it can really be that serious. And I think I'll end there.
Yeah. And for a deep dive into everything, head over to kidneystonediet.com where you'll find that article and everything else. But yeah, thanks for tuning in. This is more of a serious, not really playful episode, but it's an important one. And we hope that you heed the advice, and we will see you next week.
Bye, everybody. And guys, thanks for all the trust that you put into us. We value you very much. Mwah. Bye, guys.